If you have cancer, you face problems with depression, distress, fatigue, pain, and more. But music can be a non-pharmacological way to address these issues. So, in this video, we're going to talk about what music and music therapy can do to help you when you have cancer symptoms. Hi, my name is JD, and I'm a statistician and music therapist here to offer statistically significant support. And if you don't mind hitting those like and subscribe buttons so that you can get the support as it comes out. If you have cancer, music therapy can significantly improve your mood and quality of life while decreasing your depression and anxiety. And this can happen in just 1 to 2 months, and this is compared to just standard care alone. But when you add music therapy to standard care and then compare it to standard care alone, what you see is you get help with cancer-related fatigue. And this is particularly true with cancers of the blood, bone marrow, and lymph nodes. And it didn't matter how often you got music therapy in this case. With breast cancer specifically, music interventions can help lower systolic blood pressure, diastolic blood pressure, and heart rate. What's really cool is that this one meta-analysis reported that there were no adverse side effects. Now, as a music therapist, I can tell you that there can be adverse side effects if you choose the wrong song, if you choose the wrong intervention, or even a combination of the two. And in fact, one study found that when listening to New Age music, cancer patients had higher distress, lower positive psychology, and lower quality of life. Now, if I can interject my own opinion into this, I don't think it had anything to do with the New Age music itself. I think the New Age music just wasn't culturally appropriate for those patients, so the patients couldn't connect with it, so they had a bad experience. And this is what happens when you choose the wrong song for your patients. But again, that's just my own opinion. Now, what's typically used most is passive listening, and that's even the case for just 30 to 60 minutes for 1 to 3 sessions. But the research is kind of all over the place with time frames. So it could be 1 to 8 sessions, and then 15 to 60 minutes ranging from 3 days to 15 months. So passive listening is used a lot, but it's usually referred to being in a sedentary place while listening to the songs. And active music therapy refers to physically playing an instrument and actively making the song. So with active music making, you're actively singing or improvising or playing an instrument. And with passive listening, you're sedentary, but there's a lot of mental activity that's going along with that. So you can do things like verbal relaxation techniques, guided imagery, and matching moods. So not only are you going to experience more passive music listening experience than active music making experiences when you're dealing with cancer symptoms, but those passive experiences are going to be more effective for you than the active music making. And this didn't change if you have radiation therapy, surgery, or chemotherapy. And passive music interventions will help you reduce your pain. Moreover, the music-based interventions will reduce your pain when getting biopsies and surgery. So yes, they are effective and safe non-pharmacological alternatives to pain reduction. But the research is suggesting 2 to 3 sessions a day, and it's also showing that having a certified music therapist was important to reducing that pain. So yes, music and music therapy can help you with your cancer-related symptoms, but you do need a music therapist to help guide you through that process to make it as effective as it can be for you specifically. So if you found this video helpful, please hit that like button. And if you want more content like this, hit the subscribe button so that you can get the support as it comes out. Thank you.